Hey everyone, welcome back to my channel, and if you're new here, I am Mariana and I interview the brightest minds of physical therapy. So if you want to increase your knowledge, start right now by subscribing to this channel, clicking on the bell so you don't miss anything, give us a thumbs up and share with your friends. Today, our guest is Dr. Kathleen Antares, and she's going to talk about her experience working as a PT in the COVID ICU in a VA hospital for 16 months, right when the pandemic started. Dr. Antares is a physical therapist, veteran entrepreneur, and founder of Motioncraft Therapy. I hope you enjoy the show. PT Pro Talk podcast is only possible with the support of the forward-looking and innovative company Systems for PT, the Do Anything, Anytime EMR. Systems for PT develops systems for clinics so you can focus on your patients. Go to systemsforpt.com to schedule a demo today. Hi, Dr. Kathleen Antares. Welcome to PT Pro Talk. How are you today?
I'm good, Mariana. Thanks for having me.
Awesome. So let's get started and just tell us a little bit about yourself, your career, and how did you get where you are right now?
Sure. So I'm, as she said, Dr. Kathleen Antares, and I'm a physical therapist, but I wasn't always a physical therapist. I was an Arabic language interrogator in the Army, and I got injured and came home, and I used a wheelchair and a cane to get around for the first part of when I got back home. And when I went in for therapy, I didn't have a great rehab, so I ended up rehabilitating myself. And when I got finished with my rehab, I thought, well, this is a pretty good career choice for me. I'm not half bad at it. So I went on to become a physical therapist. And in my infinite wisdom with all my injuries, I thought the easiest thing to do after graduation would be to go into pediatrics because those are smaller people. So my thought process was easier therapy, which turned out to not be exactly right, but it was really great foundational work for me. It really gave me a foundation of development and how the body, develops and how people learn to walk and learn to do all the things that we do. So after I graduated, I became a pediatric physical therapist, but my ultimate goal was to eventually learn all the tools of the trade, put all that together in one big tool bag, and then take that back to where I had started from, which was at the VA hospital. So ultimately, after years of travel therapy and pediatric therapy, I returned to the VA hospital where I spent 6 years helping rehabilitate veterans. I moved up the ladder pretty quickly there, and I've recently branched out on my own to start my own physical therapy clinic, which is going to be in the homes and online, Motioncraft Therapy.
Awesome. And what I'm curious to ask you about is how did you end up doing PT in the COVID ICU? And how long did you stay there? So that's the topic of our conversation about COVID. I was curious to have someone here to tell us a little bit about that experience. So how was that you end up doing that?
Right. So as I said, I became administrator at the VA. I moved up the ladder, started as a PT, and then ran a couple of programs and ultimately ended up in a role with physical medicine as the clinical program coordinator. And as that role kind of developed, it was more compliance and administrative oversight, CARF accreditation and Joint Commission, and things like that. So I didn't really have a caseload from day to day. I filled in as needed in the rehab unit or in the outpatient clinic. And when COVID started, I had been at that VA for a little over a year. And the one logical choice was for me to become the COVID ICU PT because I was the only one without a full caseload that I was still managing during the day. And I also had some respiratory experience from my time in pediatrics and also my time working with ALS patients. And so it became me. And I spent 16 months there working in the COVID ICU, developing some of the protocols that we used in that particular hospital unit.
Well, I bet that was a very intense experience. So let me continue here with, I'm super curious to talk about that. So what were your roles as a PT in the ICU?
So for me, I didn't have a whole lot of ICU experience previous to COVID. I had been in some acute care settings and I had worked some ICU, but as far as working respiratory, relied on some of my colleagues in other hospitals, folks that I had known went into respiratory, and I also took a lot of courses, everything I could find on respiratory physical therapy, just things like, postural drainage and chest PT and stuff like that. But, ultimately, what they wanted from us in the ICU at my hospital was to start out with an eval on an iPad, which I didn't find appropriate. So I ended up putting on the equipment and going into the ICU and seeing the patients. And, based on my experience with respiratory patients previously versus what I saw in the ICU, it was a very different practice. It was almost like putting yourself through medical school all over again to relearn something. So we did a lot of research, and it was not just the physical therapist, it was the nursing staff, it was pulmonology, it was everyone who was involved in the care of these patients was literally doing research on a daily basis, following what others were doing and watching what had happened in other areas of the country. And I'm in Florida, so the pandemic reached us a little bit after everywhere else in the country. So I was able to, reach out to folks who had worked in New York and just kind of see what was working for them.
Yeah. And so what are the difference between the respiratory therapists and the PTs working in the ICU? Because I know that between countries, they have different roles. Like in Brazil, the PT is the one that does all the respiratory part in like an ICU, for example. And I know here it's different because you have respiratory therapists. So just curious to understand what is the difference.
Yeah. And so for us, that was the thing that I was not too familiar with, because as I had worked with respiratory therapists in other places, I really hadn't delved into what it is exactly that their role and their scope of practice is. So when I came into the ICU, for instance, the first thing I said was, what kind of exercises have you been doing with these patients? And I meant, respiratory exercises, breathing and things like that. And they said, oh, no, they're not getting PT. You're the first one. And I said, no, but, what kind of breathing exercises? And they just looked at me. They're like, we just don't have time for all that. They're covering the entire hospital and everywhere from the ER through all the regular floors for, patients that were non-COVID as well, plus doing the intubations for everybody who was COVID, both of our ICUs. It was a lot. And toward the middle and end of the pandemic, it was even worse because we had not just the ICU filled with patients, but also, other floors that we had to convert. So at that point, I thought, well, I really have to brush up. This is not going to be a case of postural drainage and a little bit of, active cycle of breathing. This is a little bit more than that. And so I refreshed my memory on everything that I already had known. Plus, I went on and just kind of learned some other things and really delved into the world of the respiratory muscles and how to get people to be able to oxygenate, because that was our main focus, was oxygenate these people and raise the oxygen saturation.
Yeah, so the respiratory therapists, they should be probably doing these exercises. It's part of their scope to do like breathing exercises. And then in that case, they were just not having enough time, right?
And I did, after a while, I said, do you guys actually do exercises? We're like, well, sure, we do them, but we're stretched. We barely have enough equipment and people to cover everything that's happening in the whole hospital, let alone, be able to sit and work with people on the breathing exercises. So they were really just managing vents and, running nebulizers and different breathing treatments to keep people going and do the things that other people couldn't do. So
yeah.
Yeah.
And you as a PT, you were just focusing on the respiratory part, or were you doing any like keep their joints, range of motion, anything like that? Or at that point was just like trying to breathe oxygen and that's it?
Yeah. So most of the people that we had didn't have an issue with range of motion. They came in, most of them, walked into the ER. And then after a short period of time, they were either, put on oxygen and ultimately some of them on ventilators. So a lot of the range of motion and things like that weren't really a thing for us.
Yeah.
Main thing, in fact, I actually told a lot more people than I thought I would ever tell to stay in bed. Normally our role is to get people out of bed, get them moving, and just get them, back to it. But for some of these folks, I mean, rolling over was desaturating folks into the 50s and 60s. And so it was a struggle
Oh, wow.
just to get them back, to 80s and 90s with their oxygen, and getting people to recognize that they were hypoxic was another issue, because some folks, I know there was a term they used in the middle of the pandemic called happy hypoxia, where people would be saturated in the 70s and just be as happy as could be sitting there and not realizing that they were really that short of oxygen in the brain. So it was a little bit of a interesting,
That's crazy.
if I had been a respiratory therapist, a respiratory PT doing like cardiovascular prior to this, and then I was advising people in how to manage, COVID and respiratory issues, I wouldn't have advised them the way that we ultimately had to go, because it was very different than what my expectations were. So
That's
definitely
crazy.
a learning process. Yeah.
Yeah. And would you deal with the ventilators as well? Or that was just respiratory therapists?
Yeah, so the ventilators were managed by respiratory therapy. So, for instance, the first time I walked a patient on the ventilator, we had quite a caravan going. We had 2 physical therapists, and we had respiratory therapy, and I think we had 2 respiratory therapists, one pulling the vent and managing, the actual settings, and another one that was just kind of watching the patient with us. And we had portable pulse ox and all kinds of, just a little thing that does really a lot more than your finger monitor. And it was quite an ordeal. As far as the settings and things on the ventilators themselves, the only thing I did as a PT was clarified what I was planning on working on. So, most of our ventilator patients were on 100%. And if you walk them on 100%, their oxygen saturation isn't going to really drop, because it's pushing the oxygen really hard. So in order to get them to advance and get better, you have to challenge the respiratory system. So I would, set up parameters with pulmonologists to just let them know what I was going to be doing to try to push the respiratory system, and just constant monitoring of the O2 sets. But as far as touching the dials or anything like that, that was not part of my scope.
No. Okay. So walk us through like a daily routine during that crazy time. What would you do?
So, as I said, my role was as primarily an administrator at the VA, working on, paperwork. So I still had other duties, which were minimized a bit because we weren't, fully operational during that time. And a lot of our physical medicine areas had shut down, and a lot of that staff had been moved to help out in other areas. So I would come in, somewhere around 7 o'clock in the morning, and just go through my administrative stuff and make sure that everything was okay there. And then at 9 a.m., I joined rounds with the pulmonary team, and we rounded on all of our COVID patients who were pulmonary. Now, I had all of the COVID patients, not just the ones who were assigned to the pulmonary team. So anybody who had any respiratory distress or was in need of, more than normal amounts of oxygen, 5 or 6 liters was the max that they were really managing on the floors. Everybody else was sent to pulmonary for observation so that, they could be monitored by them. So I would round with them, see if there's anything pressing there. If we had anybody that we were proning, we would go through, prone them, or, turn them back from prone if they had been prone, and just kind of get an update on what was there, what evaluations needed to be done, who was going to discharge, and what was going on there. And then I would go back down to my office, a little bit more work, report to my boss, what was going on in the COVID ICU, how many patients came in and how many left out, and all of the statistical things. And then back up to the regular floor, which were non-pulmonary, but still COVID. So, and then some of those folks were preparing to go home. So we've got to make sure that they can, maintain oxygen and walk across the room. So that was getting toward more regular PT, equipment evaluations and those kind of things.
And what is conscious proning, and what are the best positions that you found during our period there that would help patients' oxygenation?
Right. So in the ICU, when someone's on a ventilator, we prone them, and they were proning, somewhere 16 to 18 hours a day, because what they found was the position of the lungs in a reverse Trendelenburg, and I would put them about 20 degrees with the head up. The reverse Trendelenburg is usually around 30 degrees, but we just kind of tried to find what was best for that individual person. And it really depended on what their oxygen levels looked like in supine versus in prone, and then angling the bed and propping appropriately to protect bony areas. But on the regular floors, people were, laying in the hospital beds looking, at the walls and slightly reclined, which was one of the worst positions for COVID because oxygen saturations were low. So conscious proning is with the patient who's, alert and oriented and can prone themselves. And we had a lot of difficulties with that with older folks, because you get a lot of low back pain, and a lot of folks as they get older do not lay on their stomach. So we had a lot of education going on there with both the patients and the staff. So I ended up doing a lot of in-services with nursing, just teaching people how to instruct the patients. And what we advised was for them to do as close to prone as possible, or to just kind of find that sweet spot with the oxygen. If they're laying on their back and the oxygenation was 84%, for instance, you roll over onto your stomach with the head of the bed, the whole bed angled, not just the head, that the entire bed angled. And then maybe they would reach, 88 or 90. But if you turn to one side or the other, some people had, better oxygenation on the right or the left side, depending on, comfort levels and anatomy, really.
Mm-hmm. Yeah. And any other things that you noticed that were helping these patients overall to improve their overall situation?
I think, the main thing that I kept seeing in the hospital in general was people going home and trying to, push through it, and just, if I'm tired or I'm out of breath, just keep going. And I advise people to wait a little bit longer, take your time getting back to regular activities, because the lungs are still healing. And what we saw was a lot of people went home in, good shape, but came back a few days later again with hypoxia. And then like one guy came in and like, well, I was trying to mow my yard. So, well, mowing the yard is probably less important, or have somebody else do that, because, you got to give yourself time. You're only in the hospital walking across the room to go to the bathroom, or walking in the hall a little bit. You're not, out jogging. And I had some people like, when can I run a 5K? Those are things that you've got to work up to, and really, work with nobody knew what to expect. So we're used to, people, to get over a cold, you just got to push through it, and then you'll get better. But this was a little different.
Yeah. patients have to be more patient than ever.
And therapists have to be patient too. I found
Yeah.
myself saying things I never thought I would say, don't walk so far. And that was, don't lift heavy objects and don't push yourself too hard. And I think
Yeah.
I was glad I was in the ICU seeing these things from the start and thinking, oh my gosh, this is different than other things that I've seen. Being someone who's receiving someone that to them, maybe it's just another respiratory patient. It's, COVID, it's different, but they would treat them the same, okay, we just got to go a little bit further, a little bit further. And I think for some folks, it was very difficult and maybe
Yeah.
a little bit of a setback,
Yeah. Would you send them home with some like exercises, like breathing exercises? Would you teach them what to do?
Yeah, there were a few resources online that we were sending. I was really doing research in the beginning and advanced that a little bit, and then gave the patients my number so that they could either get a hold of me on my phone or my office. And so, in fact, I still have one patient who continually updates me from 2 years ago with her status, because she really had a hard time overcoming and going back to work, and just walking around was difficult. And so she really gave me updates along the way as to how it was going. So that shaped a little bit of what I did. But exercise wise, I told people to, hold back a little bit rather than push through it, and just start with, small things, just little, ankle pumps and circles, very minimal, leg lifts, just move around in the bed. And just the same kind of things you would probably give somebody who had just come out of a really long sickness or a very harsh, operation, and they're trying to get their strength back. Just very cautious and tentative, but progressive. Yeah.
And also probably breathing exercises.
Yeah. And, when you have a surgery or something, they give you the inspirometer. And so I was really kind of pushing for that. So all of the patients that were on my caseload got an inspirometer to just kind of see what their, capacity was, and then gave them something to shoot for. So we had we started doing flutter valves after a while. Respiratory was really managing that, and just getting people to really build back the diaphragm muscle, because it especially anybody who was ventilated or who was really, really sick for a long period of time was very weak. But the diaphragm muscle comes back very quickly too when you work with it. So yeah. And then, just active cycle of breathing exercises. And I would do, 4-count breathing, four counts to breathe in, 4 counts to breathe out. Really nothing that was holding the breath or anything, stressful on the lungs. Yeah.
And how were healthcare providers and decision makers dealing with the pandemic? Were like processes in place? Because I know it was a very stressful time. So how was that experience?
Yeah, I think, early on, we just kind of, went off of other places, what was working there. And of course, there are protocols that were handed down that we didn't have options with. It's just, this is what's working. These are the recommendations. So we follow those. From a standpoint of administration and decision making, I feel like people that weren't in there might have been behind the 8 ball a little bit, and we knew it was working and what the trends were looking like from moment to moment, whereas sometimes it seemed like some of the decisions were coming a little late. But from a standpoint of protocol, a federal facility, we were under federal governing, so we followed the federal standards. So even when, for instance, in my area, a lot of mask guidelines and such lifted earlier, we maintained that, and they may still be maintaining that, as far as I know, because that was the federal standard, and so we followed guidelines.
Yeah. And So how was your experience working like such a stressful environment? Were moments like you were afraid, you want to give up, you were not sure what's going on, you were scared to work? So how was that part, that aspect of being there in that period?
Yeah, I think the experience itself is priceless because that's a part of history, and I feel like I was part of the group on the front line, trying to find the answers, trying to find what's going to get us out of this. So looking back on it, it's a priceless experience. The first time I went into the COVID ICU, I didn't know what to expect. And so when I went in with the nurse into a room where the patient was on a ventilator, and so all of the parameters were in place, rectal tube, catheter, IVs, all of the ICU noises. It's a strong emotional experience to go in there. But then the first reaction I had was, with all of my gear on, the first time putting on that mask and expecting it to work, I looked at the nurse and I said, my mask does not work. I can smell the rectal tube. And she said, oh no, you're going to smell everything. It blocks particles. So I was like, a moment of dread, though, because this was very brand new early on in 2020, and I didn't know, my gosh, am I going to get this thing? But I never did get COVID, and still have not had COVID, and I still wear the N95 when I treat patients because I think I never know if I'm exposed to it or carrying it. So when I see patients, I still wear it.
That's impressive. I can't believe you never got it.
I worked
That's
the ICU,
awesome.
and I was in there day in and day out with people coughing all over me. But we had some pretty strict protocols for the PPE, wearing the goggles and the face mask and the shield, the double gloves in the beginning, and the waterproof gowns and everything. So, and we didn't really have the issue that other folks had with equipment. We came in, like I said, we were a little later to get the pandemic down here in Florida. And so we saw what was going on in other places, and where people were, having to just wear surgical masks in to see COVID patients because they had nothing else. And, all the stories coming out. So I think our facility was well prepared and began rationing equipment. So we kind of eased up on that as time went on, and we realized we do have enough. So
that's awesome. And what would you suggest changing in the way healthcare is provided after your experience?
Well, I think, one of the big things, just in general, not necessarily just with COVID, but I think as practitioners, we have to listen to our patients, and really patient-centered care is a thing that everyone is saying. Those are the buzzwords now. But it has to be patient-centered, which means put your patient at the center of that. Ask them the questions and see what they want, what are their goals, and base what you do on that. I think the next step has to be with decision makers listening to the staff on the front lines and really having a good liaison between folks, because sometimes practices are standardized for ease, convenience, and the majority of people will thrive on a standardized system, but you will still have people falling through the cracks if you don't provide that patient-centered care. So I don't know that standardization is particularly a pillar of a patient-centered care. And so I guess that would be my caution, would be not to, standardize every single thing and just put the check boxes out there and check them off and call it good, because that's not exactly patient-centered.
Yeah, it makes sense. Katie, before I transition to the final questions, anything else about COVID, any consideration, anything you want to share with us about your experience?
Yeah, I wish people would just be more careful with their germs and bacteria. It has made me a lot more conscious of just colds and things. And I feel like we were so much cleaner of an environment when we were terrified of catching this in the beginning. And I think people have lost that interest in, keeping their germs away from other people. But
Yeah. Yeah.
but I still work in healthcare, so I still wear the mask. So, yeah. And I walk into restaurants now, and I'm the only one in the mask anymore for the most part. So,
Yeah.
I don't see that changing when I'm around groups. I don't know what would happen if I got it. I have respiratory issues myself. So that was one of the things that really made me focus on, protecting myself.
Yeah. Yeah. I think most people are just tired of using. They don't want to they don't want to do that anymore. In the beginning, it was like, wow, just for 1 week, just 2 weeks, just one more month, It ended up being way longer than everybody expected to be. So
2 years and counting. Here we go.
yeah. So just transitioning to the final questions. What is your favorite resource of information? Any books, anything in particular that you like?
Well, I'm doing a lot more business stuff now because I'm building my business. But one of the books that really helped me, move as I moved up into more administrative roles while I was in the hospital working was Hardwiring Excellence. And that is, I think the guy's name is Quint Studer, that there's a wealth of information in that book that will help people that are in leadership or looking to be in leadership. That's really kind of a leadership Bible that I work with. Another one is called Traction. And that really is helpful for setting up your business and running meetings and just being efficient. And then one of the more recent ones that I've read is Profit First, which really, for me, that I'm more of a clinical mind and analytical mind, not a finance and business mind.
Mm-hmm.
So for me, that's an invaluable resource.
Yeah.
So, yeah.
Okay. And what would be the best advice you give to the clinicians that are starting their careers?
As a PT, I think, I do work a lot of PRN jobs still as I'm building my business. But one of the things that I tell some of the young PTs and OTs and speech therapists that we all work together is to, stick true to the values, listen to your patients. And I mean, I see a lot of larger corporations, larger industries, they're not necessarily clinicians. So their push is for financial reasons, but do what's appropriate for the patients always, and never compromise your principles for anybody else. Even if they sign your paycheck, then maybe there's somewhere else you could go, because the industry is changing. I mean, it's changing. Reimbursement rates are getting lower. So a lot of folks are moving toward a cash-based model, and the push to provide outcomes is really there. It's not good enough just to do the rubber band and the paper with 5 exercises. You really have to, I mean, I've been a PT since 2009, and I work every day. I mean, if I turn the computer around, you see my desk full of stuff that I'm working on, constantly reading the newest things, because I worked with older PTs who went to continuing education but didn't apply it. There's a lot of new stuff. There's a lot of things that are different now than when I first became a PT. And I think you have to keep up with that. I think that as the industry changes, we have to demand that change too. We have to facilitate that change and provide what we know is best. Because when you look around you in some of the venues that you're working in, you know some of that stuff is not right. So
Yeah.
that would be my advice. Don't compromise your integrity for someone else's dollar.
Yeah, absolutely. And then our final question. So what personal qualities or abilities that you think are important to become a successful physical therapist?
Definitely empathy. You have to be able to feel what these people are feeling and put yourself in their place and be able to provide care that you would want provided for yourself. Every person that I see, I view them as, a family member, someone that I really care about. And so that doesn't allow me to do anything less than everything I have to offer. Even for instance, yesterday, I had a patient that I had 55 minutes to work with. We did our full treatment and probably even went over the hour a little bit. And just as we were going back to his room, he said, I think I have to go to the bathroom. So you have to provide that. I could have taken him up and said, hey, he just said he's got to go to the bathroom and let nursing deal with it. But it might not have been right away. And it's, an extra, putting in the extra time is really just the extra care. So I think empathy, I think flexibility and resilience are important, because you have to be able to be available when you're needed. This isn't really a 9 to 5. And as a business owner, I'm finding that there's really no time that you're not on. You're always doing something for the greater good, and resilience, you have to be able to bounce back from whatever kind of adversity or whatever is happening. So, and there's a lot of that out there. There are a lot of people pushing against. So, and then, a lot of other qualities that go along with integrity. I mean, absolutely. These people's lives are in your care. And, when you're seeing these folks, this is at their absolute worst most of the time. Yeah. Patients always apologizing for the things that are happening. You're in the hospital, just had surgery, and we're trying to get you back to your best, but we see you at your worst, and that's okay. And you have to be able to have, compassion for that.
Yeah. Yes, I agree. Sometimes it's hard, but that's our, we chose this career. That's how it is. So Katie, if people want to learn more about you or they want to contact you, is there any way that they can find you?
I think, I'm on Facebook, Katie Antares. And if you put that in there, you'll find me. My business is Motioncraft Therapy, and that's not fully operational yet with the website. We're still in the works with a few things with the ebook, and everything is still kind of moving forward, but moving slowly. But if you want to get in touch with me, katieantares at gmail.com, KATIEANTARES at gmail.com is my email. And I'm in there daily. And, eventually my website will be up, so you can check on Facebook. You can send me a Facebook friend request, or, like my Motioncraft page, and you'll get some information there too. But ultimately, my therapy practice is going to be Motioncraft Therapy, and it's a functional medicine based program. So it's really working at getting to the root of the cause of problems, and specifically, I treat chronic pain. So really trying to find a cure for that, because I still have my own chronic pain. So we're working toward improving the quality of life for as long as, people want to enjoy life.
Yeah, absolutely. Well, I appreciate so much you taking the time to be here and share your experience. I've been looking for someone to talk about COVID experience for so long. I'm so happy I found you. And I appreciate you accepting my invitation and being here to share all of that with us. So thank you so much.
Well, thank you. Thanks for having me. I think the people around me have been kind of tired of hearing about my experience in the COVID ICU. So it was a good, mutual exchange, because it allowed me to kind of, talk about some of the things that you just kind of hold inside. We've got a couple of lights in a very dark time. I've got a couple of people who came off the ventilator and rehabilitated and walked out of that hospital with their own lungs and are enjoying their lives. And they still reach out to me once in a while just to let me know what they're doing. So that's why, that's the why. And that's the thing that keeps it going. So yeah, thank you. Appreciate it.